Good afternoon. My name is Dr. Danessa Thomas, and I'm speaking on the topic of healthcare leader strategies for leveraging electronic health records. The learning objectives for today's presentation is explaining the background of electronic health records, explaining the importance of and the need for the study, determine the purpose, business impact, and social impact for the study. I will be explaining the findings and recommendation for further action to implement electronic health records in a physician's office. And you may notice throughout my presentation that I use the abbreviation EHR for electronic health records, so I may use them interchangeably. I may say electronic health records and I may say EHR, but just know that I'm speaking of the same thing. A little background about myself. I have over 18 years of experience in the healthcare industry with health insurance. I'm a provider resolution manager senior at Anthem Blue Cross Blue Shield of Georgia. I've had work experience with medical records since 2003, so I've always been interested in that topic. So when I started my dissertation, I wanted to do something that was related to my job. My future goal is to create a nonprofit organization for teen mothers to provide educational services, parental advice, and emotional support. And this is a personal journey for me because I was a teen mother at the age of 15. My motto is, I never wanted to be a negative statistic, so I became a positive one. My dissertation was published in ProQuest in December 2021. My hobbies include shopping, reading, spending time with my family and friends, especially my grandson. So I put a timeline of pictures just to explain my journey. The first picture is a picture of my son and I, Trey, at my high school graduation in 1998. I was 17 years old and I was a top 10 graduate of my senior class. The second picture is my son's high school graduation in 2014 from Jordan Vocational High School. So that was a highlight moment for me because I graduated from high school and my son graduated from high school. The second picture just depicts my educational journey, so I can explain. In the blue cap and gown, that's myself, graduated from high school. The second one is my high school graduate self handing my Columbus State graduate her degree. And I have a bachelor's degree in computer information systems from Columbus State University. In return, my Columbus State graduate self is handing my Troy State University degrees, and I have 2 master's degrees. I have a MBA and I have a master's in human resource management. And then the third it depicts myself from Troy University, handing myself my degree from Walden. And as you can see on the last picture, I have all of my degrees and my high school diploma surrounding me with my Walden tam and gown on. So I just wanted to depict that just to show that although I was a teen parent, I never let anything stop me from getting my education. And my third picture is just a picture of my grandson, Keegan. He's 5 years old, and my son, Trey, he's 25 years old. And that was a picture taken at my mom's house on Christmas Day. A little background of electronic health records. So first, I'll start off with the definition. What is an electronic health record? An electronic health record is a digital version of a patient's record that is available to providers who access the records through an electronic health record software system, such as Epic and Cerner. Those are 2 of the largest electronic healthcare software systems that provider uses. An EHR contains the patient's medical history, diagnoses, and treatments that are notated by a provider. Some providers have not implemented an EHR system due to financial reasons, such as the cost for the systems and production, meaning production-wise, they don't have a full office staff. It's a small provider's office. They have a small amount of patients, where EHR may not be feasible to implement. In healthcare, EHRs are used as a form of communication between providers and patients. It gives patients an opportunity to access their medical records without physically going to the office to maintain their medical records if needed. So you all may remember, or you still may have to do it because some providers still use paper files. And if another physician needs it, you have to go into the office and sign a release form so they can release your medical records. As if they had an electronic health record system, you wouldn't have to go in and sign. They could just transfer those records over to that physician for review. Also, EHR is located on a secure website, and it reduces unnecessary costs such as physical space for medical record folders and office supplies such as paper, printers, fax machines, ink. It's just it's just more convenient to some to have an electronic record system. Research question to my study is, what strategies do healthcare leaders use to leverage electronic health records in their organization to increase profit and productivity? So my participants in the sample size was 4 nurse managers and 4 physician offices in the West Central region of Georgia. The 4 nurse managers were successful in leveraging an EHR system with an increase in profit and productivity. They had experience and knowledge with implementing and using an EHR system. And I also used criteria sampling to choose my participants. And I can explain what criterion sampling is focused on the participants' characteristics, which identified and understood electronic health records, and the strategies that were used to increase the profit and productivity. Basically, with criterion sampling, it was just a selection process used and based on determining factors that I decided to use to come up with this for the participants that I wanted to use for my study. This is a demographic characteristic table that I created. Once I was able to get the participants, I actually sent out 13 invites to people that fit the criteria, but only 4 responded back, which was pretty good because it was a lot of work. So basically with this table, the title is the participants' years of work experience in a physician's office and years of electronic health record experience. As you can see, I did interview 3 nurse practitioners and 1 registered nurse. The nurse manager's work experience is a combination of 53 years in the nursing field and a combination of 49 years of electronic health records experience. So I got a lot of information from these 4 nurse managers as I was doing their interviews. And the instruments and data sets that I used the semi-structured virtual interviews using Zoom, 8 interview questions that I read in sequential order. And at the time, when I got IRB approved in 2020, COVID-19 was raging. So I was unable to do face-to-face interviews. So Zoom was the way to go. Also, I just want to say, when I first started to do my research, I wanted to interview office managers, but I soon learned that office managers really did not use the electronic health record systems. Majority of the time, it was the physicians, it was the medical staff, the physicians, the nurses, lab techs, things of that nature. So I switched it around to nurse managers because the nurses really use those systems more than the physician do. And you'll later learn that as I go along. I reviewed and analyzed public organizational documents. I used direct and participant observation as we was doing the Zoom meetings. I looked at facial expressions and just to see how they reacted to the questions that I asked them. And in regards to the data set, I had 4 interview transcripts that served as the data sets for the study. Research design, I used a qualitative research method which was appropriate for this study because it strengthened the credibility of the research. As the researcher, I did serve as the primary data collection instrument. And again, I stated that I used the semi-structured interviews through Zoom, where I asked 8 interview questions in sequential order. I could not get access to private financial records, statements, or training modules, so I had to review public documents and public organizational documents regarding Cerner and Epic. And the providers, the participants, I was able to pull their statements because they did have some of them on the website. I think it was like 3 of them, but one of them wasn't online. So I was able to review that information as well. In regards to the multiple case study design, I used that to gain a better understanding of leveraging electronic health records from different physicians. It best fit because it inquired on a topic with a real life setting, because we all know healthcare is very important, and everyone, well, not everyone, but majority of people do go to the doctor for, routine services or if they're sick. And also, it allowed me as the researcher to generate in-depth insights to explore the underlying issues of a phenomenon. So after I got all of this information with the interviews, I compiled and organized the data using TranscribeMe, which transcribed the interviews. And it's a service that recognizes speech recognition and translation. I also did a manual transcription as well to make sure I didn't miss any important pieces in the interview that TranscribeMe may not have caught. And that's where the interview transcript comes from. After that, I classified the coded data with software called In Vivo 12. With that, thematic analysis was used to focus on patterns and themes within the data. So basically, I inputted all of the interview information from all 4 participants in Vivo 12, and I noticed that when they said a majority of the same words, I was like, okay, that could be considered a theme, but it was a code, so I would color code that particular word or phrase. And that's how I was able to form my themes. And I also did a manual color-coded system as well to make sure I didn't miss anything that I didn't see when I used the In Vivo 12 software. From there, I identified, interpreted, and developed the codes and themes that were commonly used in the semi-structured interviews. I did a methodological triangulation to enhance the credibility of the study. From there, I did member checking. And that's why I referenced the interviews through to validate the trustworthiness of the study. So what I did, I emailed each copy of the interview transcript to each of the participants for accuracy and validation. And we have to do this in case they say, well, I didn't mean to say that, or don't use that part in your study, and I have to take that piece out. However, only 2 of the participants sent the email back saying that everything looked good and I could move, and it was okay to move forward since no changes was needed. And the results of my study, these were the themes that came from the result of the study, and they were the importance of effective communication between EHRs, usability of software for EHRs, requiring accurate documentation, and additional training for the medical staff. And I'm going to explain each one and then advise you of the findings. So the importance of effective communication between EHRs pertains to systems designed to communicate with other providers, assessing patients' medical records, which contributes to the continuity of care. Over 70% of incidents cause patients harm in healthcare facilities due to communication failure. The subtopic, Navigating EHR Implementation and Leveraging Challenges, it relates to technical support which arise when the system goes down. So key findings that I found regarding the importance of effective communication between electronic health records word contribution towards continuity of care. And what continuity of care is concerned with the quality of care over time. So the patient and the physician-led team, they get involved in ongoing management toward the shared goal of high quality of care. So continuity of care is big in the health world, so that is important. Facilitate communication with other providers. And regarding the technical piece, organizational innovation to improve technical setbacks, privacy threats, and disruption of workflow. Just looking at the participants' responses, participant 3, I just wanted you all to see exactly what the participant said. So participant 3 emphasized, our leadership team decided to switch to a Cerner system because they were bought out by a for-profit corporation. The office was previously state-owned and now it is privately owned. Participant 2 stated, our office switched to Epic because it was easier to review and transfer patients' records to the larger facilities like Piedmont Emory. And Piedmont Emory are two of the largest facilities in the state of Georgia. Participant 1 mentioned the workflow setting flows better when using electronic health records. And participant 4 indicated the computer may go out or sometimes records are not interchangeable because the new system updates are being implemented. The IT support team and the vendor are still working the bugs out. All of the participants did agree and stated that their office is equipped with technical support services 24/7, 7 days a week. And also, they appeared to be open to innovations of improvising when faced with challenges such as technical setbacks, privacy threats, and disruption of workflow. Usability of software for electronic health records. And what that is, it's the software that is essential to the staff and patients. For the health information, the medical records is digitally stored for each patient. The subtopic time management is defined as organizing and planning on how to divide time between charting and patient's care. Some key findings of usability of software for electronic health records is digitally stored health information that can be shared among different providers or physicians, access to review and transfer patients' records, organizing and planning between charting and the patient's care, prioritizing decision-making, scheduling, and multitasking, which improves quality of care. Some participant responses regarding usability of software for electronic records. Participant 2 stated, we reach out to patients and schedule their appointments to come in the office. We schedule future vaccinations, testing, and mammograms to efficiently manage each appointment and take care of the patients with care without rushing. Participant 3 mentioned, continuity of care plays a major role where we all cooperate to provide quality of care. The participants implied that prioritizing, decision-making, scheduling, and multitasking will improve the usability of softwares for EHRs. A patient care is lax when unnecessary time is spent doing bedside charting. And bedside charting means you're standing there writing down the information instead of paying attention to the patient or what the patient is saying. Participant 4 indicated everyone cannot be in the system creating notes. If so, the notes are deleted and have to be rekeyed. And I think that was a technical issue as well for that particular participant's office regarding their software. They also mentioned that the EHRs were implemented in their particular office to save money, increase profit, keep track of medical notes, and because there is a mandate to use an EHR by the state of Georgia. The third thing is called requiring accurate documentation. And what that is recording medical information regarding a patient's demographics, medical history, diagnoses, and prescription record. The subtopic, which is paper charting and productivity, refers to using paper to write down a patient's medical information if the system goes down. which affects productivity. The key findings for requiring accurate documentation is quality documentation, appropriate reimbursement, accurate diagnosis or diagnoses for a patient. Paper charting is an alternative when the system goes down. And with accurate documentation is less duplication of work, less need for tedious tasks, focus on a patient's care, improve retention rate, and morale. And the participants had a lot to say about accurate documentation in their office because a lot of people have to write and put in notes. So participant 1 stated, documentation is mostly due to human error, not the system itself. Documenting is difficult because there are a lot of codes to use, which differs with ordering labs or medication. It is important to document correctly for the next physician or nurse to review and move forward with the patient's care. Participant 3 indicated a lack of documentation can become an issue if the medical information is not charted and uploaded into the system. Everyone has access to the system, so one person can add or delete from a patient's record. Participant 4 noted, electronic health records make it easier for documenting because we do not have to keep up with papers. It is easier because the records are stored in the computer, get copies, and transferred as needed. Participant 1 stated again, paper charting is important because the patient comes first. However, it causes a big conflict when the physicians want to stand there and chart the information right then. And the nurses must write everything down on paper. Once the system comes back up, the nurses must put in the vitals in order. It causes conflict because it is a time constraint, especially on a busy day. And participant 4 emphasized, it is time consuming as well, due to the patient's information has to be completed and closed in the electronic health record that day. Also, it is an inconvenience having to sift through years of paper records and keeping track of them. Nevertheless, the staff is productive while continuously working and providing their patients with care. Since the nurses and staff works closely with the physician must have effective communication and listening skills. Everyone must understand the office protocols when the system goes down and have to resort to paper charting. And my last thing is additional training for the medical staff. And in regards to additional training, is obtaining additional learning skills for an EHR system through clinical modules to train and develop an employee in their job position. The subtopic, staff workload and profit, is based on tasks assigned to the staff. Profit plays a vital role in additional training due to improving operational efficiencies, lowering overhead, and an increase in revenue due to accurate billing and coding. Some key findings for additional training for the medical staff is training and developing through clinical modules. Tasks assigned to the staff consist of planning and controlling production, which is scheduling appointments, lab work, referrals. Accurate billing and coding improves operational efficiencies, lowers overhead, and increases revenue. Some of the participant responses regarding additional training for the medical staff, participant 3 stated, a lot of our employees were retrained on the new Cerner system. It was hard because some were not computer savvy. The training was conducted by a Cerner's consultant. And once a provider implements a EHR system, the technical support people, they do come out and they do train the staff, give them a training lessons on the software and on the computer, but a lot of times they still have to learn on their own. Participant 2 mentioned our employees struggled when we went to the Epic system. And think I remember participant 2 telling me that they had a lot of, well, not a lot, but they had a few older employees in the office, and they were not used to using a computer. They was not used to technology, so it was hard for them to learn that EPIC system. For participant 1, emphasized it was difficult because there were a lot of codes to learn. By taking notes and writing down the steps, it helped because the steps are repetitive. Participant 4 indicated during training, the system was easy to navigate and learn quickly, but not user-friendly. All of the participants indicated that their respective office increased their profit margin through billing and coding after implementing a new system with software to accurately price the medical services rendered. Therefore, the participants conveyed that the strategy, additional training for the medical staff, improves an employee's productivity and performance while increasing profit for the physician. The purpose, business impact, and social impact of the study. My target population again was 4 nurse managers who worked in 4 physician offices in the West Central region of Georgia. The nurse managers also had successfully leveraged and implemented an electronic health record system. The word leverage is used to indicate that providers use an electronic health record system to maximize the value of their practice and patients, physically and financially. The business impact allows providers to have easier access to patients' data and privacy to medical records with fewer medical errors such as misdiagnoses and prescription errors. The social impact of electronic health records on a national and global platform will help modernize healthcare. It will enhance much needed medical treatment and drug services based on a patient's diagnosis, prior treatments, therefore lowering or decreasing healthcare costs. 2 conclusions that I came that arose from my study were: 1, healthcare leaders may apply the findings from this study to their professional practice by exploring strategies to improve profit and productivity, 2 critical financial assets in a healthcare organization. Healthcare leaders may apply the findings of this study to develop strategies to improve healthcare operations by developing an organizational culture to promote integration and usability tools for EHRs among the medical community in accepting electronic health records. By developing the services related to EHRs and methods to facilitating improved, secure communication between patients and healthcare, as the federal government's meaningful use incentives dismantle the financial obstacles that hinder EHR implementation, individual practices will get a chance to realize the operational and clinical benefits associated with the technology. However, I do have 2 unanswered questions. 1, will other provider offices be able to afford the software and equipment to transition from paper filing and electronic filing? As of 2017, 31% of physicians have not implemented electronic health records, using only paper records in their office. The second unanswered question is, will the smaller provider offices in rural areas be able to interface with different departments at a hospital and other provider offices? There is a challenge to assimilate EHRs in these small practices because the attention and resources are limited. And I remember one of my participants saying that their office was in a rural area, but they have the EPIC system. However, she said, if the hospital uses Cerner and they use EPIC, sometimes they're not able to transfer a patient's medical records. So that's something that should be looked upon, because there are other electronic health record system companies that are out here that are not as big as Cerner and EPIC. So it should be, someone should actually look into that, and so everybody should be able to transfer medical records no matter what type of system that they're using. So future explorations, if I want to conduct another study, what I would do, I would duplicate the study in other areas of Georgia. I would definitely still focus on users, such as the medical staff, who enact on all electronic health record workarounds performed daily through direct and indirect observation. I would, if I'm able to go back in the office with COVID, some providers are still, you have to have an appointment to come in. You just can't come in just to observe. I would use a larger sample size of participants who work in a physician's office with different titles, work experience, and electronic health record experience, and also telehealth electronic health record implementation due to coronavirus pandemic. And the further study related to improved practice for physician offices due to COVID-19, as I said before, some medical practices were not making money, and 40% or more of their revenue were going towards overhead costs in 2020. Telehealth had increased over the past year due to the virus and safety for the patients to see a provider in the comforts of their own home. And if you're not familiar with telehealth, what it is, you can call in to a provider and do a web call or through your webcam. You can give them your symptoms. They'll look at you. I mean, they can't give you your temperature or anything like that or check your heart rate, but they'll try their best. Or if they can't diagnose you, they'll tell you to go to an urgent care or a emergency room. So basically with telehealth, that became the norm for 2020 and 2021 due to COVID. Because a lot of providers had closed their office down in-house or for office visits due to the virus. In summary, just restating the learning objectives that we spoke about today, explaining the background of electronic health records, explaining the importance of and the need for the study, determining the purpose, business impact, and social impact of the study, explaining the findings and recommendations for further action to implement EHRs in the physician's office. So recommendations for actions where nurse managers may be able to apply these findings to increase profit and productivity when leveraging EHRs is training the medical staff and taking advantage of the federal government's meaningful use incentives to implement an EHR system. Some distributions of findings that are recommended is certification courses held by the EHR companies such as Cerner and Epic. So take advantage of if the companies are offering those courses, take advantage, become certified, customized peer-to-peer training for each of the medical staff, doing presentations with literature at employee workshops, and also forming a training manuals for the EHR system for your particular office. And the last question, how does the information from the presentation extend into other areas of real life or the profession? So my take on it is, it extends to other areas of real life or the profession because we are living in a time where technology is taking over. And majority of businesses are managing everything digitally with less personal contact. Although some professions are not financially stable or stubborn to make the changes, eventually everyone will be overseeing and transferring their business electronically. My contact information, Dr. Danessa Thomas. I can be reached at danessa.thomas@waldenu.edu. Please contact me for any additional questions or comments. Thank you.